Start. The J&K and Ladakh High Court's latest directive, summoning the managing director of the J&K Medical Supply Corporation Limited to explain the non-supply of Factor 5 and personally ought to have felt like a decisive moment. Stop. Instead, it feels verily familiar. Stop. This is not the first time the court has intervened. Stop. It is not even the second, hemophilia patients across the Union Territory have watched this case wind through hearing after hearing, order after order, while the medicines they need to survive remain more often than not unavailable. Stop. Para. What makes this crisis particularly indefensible is the existence on paper of a robust system designed to prevent exactly this outcome. Stop. J&K operates a centralized procurement model precisely so that medicines and medical equipment can be bought in bulk at uniform, reasonable prices with quality assured through a structured tendering process. Stop. JKMS exists as the single agency entrusted with this responsibility. Stop. The logic of centralization is sound, it should mean better bargaining power, consistent standards, and predictable supply chains. Stop. However, the practical experience of patients at Government Medical College Srinagar and GMC Jammu reveals a different reality, one of chronic recurring shortages that no amount of policy architecture seems able to resolve. Stop. Para. Hemophilia is not an ordinary condition. Stop. It is a rare bleeding disorder in which patients require immediate clotting factor replacement the moment a bleed occurs. Semicolon. Hours, not weeks, determine whether a joint is saved or permanently damaged, and in severe cases whether a patient lives. Stop. Compounding the tragedy is the fact that these medicines are not freely available over the counter or through private pharmacies in adequate quantities. Stop. When the centralized government channel fails, there is often no realistic alternative for ordinary families, particularly the poor who cannot afford to import expensive medicines from outside the Union Territory. Stop. So, where precisely, is the breakdown occurring logically, there are only a handful of plausible explanations. Stop. The first is that the drug is simply unavailable anywhere. Stop.